Dr. Howard Prager, and today we're going to discuss what makes our office different from any other doctor you have seen. We treat patients metabolically and neurologically. You're watching this DVD because someone you or someone you love is suffering from a chronic health condition. I'm here to tell you that by using specific metabolic and neurological testing and treatments, no stone is left unturned to determine the exact cause of your chronic health condition. Metabolic treatments are based on specific lab panels by using specific blood tests such as a thyroid panel, a complete metabolic panel or CMP, a lipid panel, a CBC or complete blood chemistry with autodifferential. We can assess your thyroid, adrenal glands, and liver using the above lab tests. All can be affected with a chronic health conditions. Now, by addressing any problems with your thyroid, adrenal gland, blood chemistry, or gut function, we can help you to heal faster. The CMP also allows us to check your blood glucose levels, since glucose and oxygen are needed by the brain to function properly. We also do sensitivity testing. Stool samples to determine if you have a sensitivity to gluten, which includes wheat, rye, oats, and barley. A sensitivity to milk, eggs, yeast, and soy. If you are sensitive to any of these food groups, it could be making your condition worse, as it will increase inflammation in your brain and throughout your body. If you have any of the following symptoms, you could be suffering from sensitivity to gluten, soy, milk, eggs, and or yeast. Here are some of the symptoms of these sensitivities. Chronic pain or fatigue, frequent indigestion, being bloated after eating, frequent loose bowel movements, or the opposite, constipation. You may have mouth ulcers or sores, and you could be vomiting often. The only way to find out if you are suffering from any of these sensitivities is to run the test. Another test that we do is the Adrenal Stress Index, or ASI. We can further test your adrenal glands with this test called the Adrenal Stress Index. This is a salivary test, much like DNA testing. Your adrenal glands are your stress organs, meaning they react to all sorts of stress. If you have been or are currently under stress, this test is an absolute must. If you suffer from insomnia, this test will measure your cortisol levels. When your body's cortisol levels are abnormal, you will suffer from insomnia. Cortisol levels can be corrected via specific nutritional protocols, thereby eliminating your insomnia. Another test that we do is autoimmune disorders. We may test to see if you have an autoimmune disease. An autoimmune disease is when your immune system attacks a particular area of your body, such as your nervous system, your joints, could be your connective tissue, and very commonly your thyroid gland. So we test for specific antibodies to determine if you suffer from an autoimmune condition, which is very common. Here's a good example. Many chronic pain and fatigue patients that I have treated have tested positive for thyroid antibodies, and they will actually be misdiagnosed. If your thyroid tissue antibodies, either the TPO or TBG, are high, you are suffering from Hashimoto's disease, which is the most common autoimmune disease in the United States. The only way to find this out is to test for thyroid tissue antibodies via your blood work. Your immune system can be attacking your nervous system, which would cause pain and numbness. The only way to know this, again, is to run the test. If you suffer from tissue antibodies, further blood work will be needed to determine which part of your immune system is not functioning. And specifically what this means, we need to run immune panels. Immune panels are made up of the lymphocyte subpopulation, Th1, Th2 cytokine panels, and lastly, natural killer cell activity panels. The immune panels will give me an in-depth picture as to what is exactly happening with your immune system. If you are suffering from an autoimmune disorder, it trumps everything, and it must be dealt with first, before anything else. Another test that we run is for H. pylori. This is a breath test that determines if we have H. pylori bacteria to let us know if you have any problems related to gut function. Another thing we do is intestinal permeability. This is used to determine if any of the patients are suffering from a leaky gut syndrome. LGS, or leaky gut syndrome, describes the condition of altered or damaged bowel lining. This is caused by antibiotics, toxins, could be poor diet, parasites, or other infections that can lead to increased permeability of the gut wall to toxins, microbes, as well as undigested food, waste, or any larger than normal macromolecules. It has been proposed that these substances affect the body directly, while others postulate an immune reaction to these substances. Another thing that we do is test for neurotransmitters. We test for decreased brain neurotransmitters. Neurotransmitters are vital for proper brain function, and decreased neurotransmitters can cause increased pain. Another thing we do is we may run in hormone panels. We can check hormone panels to determine if you suffer from a low progesterone in males or low estrogen and progesterone levels in females. Symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina, which is very common in today's world. Inflammation. And finally, we need to test for inflammation in your system by checking for homocysteine levels and C-reactive protein. Many patients suffering from chronic health conditions suffer inflammatory processes. Just about every fibromyalgia patient that I have treated suffers from some form of chronic inflammatory process. And these are, once again, blood tests. Glutathione also makes us different. We use glutathione in our treatment of all our chronic patients. Glutathione is the mother lode of all antioxidants, and glutathione cannot be taken orally in pill form, as the body will not absorb it. We have seen miraculous changes in some of our patients as a result of specific glutathione protocols. And glutathione is especially helpful with all autoimmune diseases. We do neurological treatments based on specific neurological testing. And we're going to go through what those specifics are now. Number one, oxygen therapy. Oxygen is fuel for your brain and nervous system. Your brain and nervous system need two things to survive, both fuel and activation. The fuel comes in the form of both oxygen and glucose. By using oxygen, we will help you heal faster. By using exercise with oxygen therapy, we can increase firing to the brain. By increasing firing to the brain, we can help many chronic conditions. Another thing that we do in the office is vibrational therapy. Vibration fires the back part of the brain called the cerebellum. One of the functions of the cerebellum is to control spinal muscles. We may also use auditory, visual, olfactory, and caloric stimulation to increase firing of the brain. We may also use laser therapy. Again, it's cold laser therapy in our office, which is high-powered and helps the tissues to heal faster. Another thing what we might use in the office is interactive metronome. This is a computer-based program that uses visual, auditory, and motor stimulation to increase firing of the brain. Once we have run all the necessary tests to determine your specific condition, we can successfully treat you via proper neurological and all nutritional protocols. I want you to ask yourself the following questions. How has your chronic health condition affected your job, your relationships, your finances, your family, and or other activities? What has it cost you in time, in money, in happiness, in lack of sleep? Where do you picture yourself in the next 1 to 3 years if this problem is not taken care of soon? And lastly, what is it worth to you if we can improve your condition? Here's what to do next. If you're really serious about the possibility that there could be an alternative treatment for you or your loved one, you can call our office at 973-729-8000 in Sparta or 201-651-0062 in Oakland, and tell the staff person you're interested in setting up a free screening with me. I want you to know a little bit about myself. I've been in private practice in northern New Jersey since 1983. I've been an affiliate staff member of St. Joe's Regional Medical Center in New Jersey. I was one of the founding doctors of the Facial Pain Center at the hospital. I am working in conjunction with Dr. Mike Johnson, the author of What to Do When the Medications Don't Work, a non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. Now, Dr. Johnson consults with over 1,000 chiropractors nationwide, in which he teaches us all the above protocols that we mentioned. Dr. Johnson's website is www.lifechangingcare.com, and my website is NJLifechangingcare.com. I am also a holder of 4 U.S. patents in the field of orthopedic products. Over the past 26 years, I have successfully treated thousands of patients. Will you be my next success story? I'd like to thank you for watching this video, and I hope that you can contact me soon regarding helping you or one of your loved ones. Thank you very much.